It's time for Senior Talk with Leah Veschio, presented by the Bluffs of Flagstaff on KAFF Legends 93.5, AM 930.
Good morning, everyone. This is Leah from the Bluffs of Flagstaff here with Senior Talk, and I'm super excited to introduce Regina Deck from Sugar and Spice. Welcome, Regina.
Thank you for having me. I appreciate it.
We were just talking before we went on the air, and I would love you to share. So where did you come up with the name Sugar and Spice, and kind of give me an idea what your mission is?
Sugar and Spice has the name because I wanted it to sound familiar to people. I wanted it to be memorable, and I wanted it to give people that warm, fuzzy feeling when they heard it. I had actually come up with another name prior to this one and found out that it was already a franchise. So I was just thinking of what else could it be? And I was like, God, what else? You got to have another name for me. And I heard it, Sugar and Spice. And I thought about it for a while, and I'm like, that is perfect, because when I imagine this company, one of the things that I imagine all of our caregivers doing is just hanging out in the home, making cookies, baking dinner, all those kinds of things together. And the name just fit perfectly.
Now, Regina, you're a registered nurse.
Yes.
And so I have to tell everyone that I've known Regina for many, many years as being a nurse as well. So, when I think of Sugar and Spice and everything nice, I can definitely tell you Regina is super, super nice, always has been, at least as far as my interactions with her. So it's not a franchise. This is your own business.
Right.
Yep. And so you're a little bit unique out there. You have a lot of services. So can you just give me, I want to go into details of each of your services so we can share with our listeners, but can you give me an idea what makes you different than the other in-home care?
I think there's a lot. The main thing is being a nurse-owned and operated company is that we provide a higher level of services. So all of our intakes are done by a nurse. So you always have a nurse coming to the home to evaluate your medications, your medical history. We want to know if you're on blood thinners and you're a higher fall risk factor and things like that.
So you say a nurse actually goes into the home. So you're actually bringing that clinical piece into the home a little bit.
Yes.
Right? Which is kind of what home health does, but you're doing it on a different level. So can you tell me the difference between
So
that?
we are definitely different from home health. So we are a caregiving non-medical company overall. However, because we have two nurses that work in our company full time, we do have that oversight. So for example, there's been extra things that I've done lots of times throughout the course of the 5 years of the company. If you have a patient or a client, a resident or a family member who has like a Foley catheter, sometimes with men and dementia, those get pulled out inadvertently, accidentally. So what I've been able to do is go to the medical supply store, gather up the supplies, get the doctor's order, and go back and replace it in the home without them having to go to the emergency room.
Wow.
If somebody falls and has a skin tear, sometimes that's an ER visit.
Right, absolutely. Or a clogged tube feeding.
Yes.
I bet you could fix that too,
yes,
right?
Yes.
Yeah.
And you would think that because we're a non-medical company that there's a lot of things that we can't do, but we can actually do quite a bit. So involving PEG tubes. We had a client.
So everyone, a PEG tube is a tube that goes in the abdomen, and we feed our you get fed through the PEG tube. Just want to clarify.
Yes, thank you. Yep, it's a
nurse talk
tube.
here.
So we've been able to come up with a system where the caregivers can actually help manage the care of the medications and the food and the supplements and the shakes and all those things that need to go into the PEG tube in a safe manner where we're not administrating the meds, but we're working alongside that patient to, I don't know if I,
to be
maybe
more
I just
autonomous, right?
Yes, be more autonomous. Yes,
Okay.
we developed this little system with a funnel and a gasket, and I was at a auto repair shop figuring out all this stuff and put it all together and went to the house and figured out a way that we could assist because the client had tremors, and so when she would try to administer the medications and things herself into her PEG tube, she couldn't, and she didn't have the dexterity to plunge the plunger on the syringe. So we worked out a system where we put the funnel and the gasket, and we hooked up this whole system, and then she was able to, we would hold and stabilize the funnel, and she would dump her medications in.
Right.
But the caregiver would mix up all the concoction first and get it all ready with the medications and the water and everything. And so
it's funny.
There's different things we can do.
When I went on your website, you have this whole list of all the services you supplied. You need to add troubleshooter, right? right?
Yes.
I mean, that's something that's
huge problem
that's
solving.
So problem solving that really helps make people at home be able to live their best life. So I feel like you're giving them more autonomy and the opportunity not have to go into a hospital setting or something like that, or into a community that can do it. They can still do it themselves. So that's actually really beautiful.
Yes.
So I kind of want to go through a little bit of the services that you offer, because I also, in addition to that, really big one. Tell me what concierge means to you.
So concierge is more of a fancy term for helping people go do fun stuff.
Okay.
Maybe it's going to the movies. Maybe it's going to lunch with a friend. Or maybe you have every Friday morning coffee date with your friends and you want to go. It could be going to the salon. It could be helping you get to your doctor's visits. It could be making a trip even out of town. Sometimes we take people all the way to Mayo Clinic in Phoenix for a doctor's visit.
So you drive them? You actually
we drive them. Mm-hmm.
Okay. So if they want to go grocery shopping, you would be able to take them to whatever it is whatever those errands look like to them, or fun.
Exactly.
Things do that.
Yes, and sometimes, in this techie world, there's like Instacart, and you can shop and do everything at Walmart without even going in the store. But sometimes people are overwhelmed with, how do I sign up for that, and how do I register, and how do I find all my things? And so a caregiver can come in and go, okay, well, you like Campbell's chicken noodle soup. Let me help you go on the website. We'll choose the exact size that you have in your cabinet, and we can restock for you.
Right.
That techie stuff is kind of hard to navigate sometimes.
Right. I get a lot of calls. It just makes me think when you say concierge is sometimes when family is from out of state, so they're not in Flagstaff, and their loved one has to go to the hospital. And it's really hard for them to navigate, trying to get into, find out what's going on, or just having, I know now it's a little unique, but we used to be able to go to the hospital and check on our loved ones. Do you do stuff like that?
If they'll let us in with COVID. Yeah, we can
like in the old days, you would.
Right. Yeah. And a lot of times I like to go to the hospital if they'll if it's allowed to come in and see that client before they come home. Right. Because if I can see what they can do at the hospital, I can see what physical therapy is doing with them there, and respiratory and OT, then it gives us a better idea to help them be successful at home.
Because you have your eyes on them. And I think that would really be helpful to families, having that clinical expertise to go in, who understands what a hospital patient looks like, and what a client or resident or need to be when they get home. So let's talk about the home environment. Another question that I get is, my mom has to go home and I'm not there, and I'm worried about, is her house ready to, keep her safe? Like, what do you do?
Sure.
There.
Yeah, so I can come to the house before she even comes home, and I can do a walkthrough with the family and figure out, okay, what does she need, and what's safe and what's not safe, and how can we inexpensively improve the environment for her. And a lot of times people just don't think about that at all. Like, for example, we just recently signed on a client. She was very, very weak, had spent 10 days in the hospital, and that happens. They become very, very, very weak over the course of a hospital stay. So then they get home and they think, oh, well, she fell when she was at home. That's the reason why she's in the hospital. So when she comes home, I should put a mattress on the floor for her, right? So then she doesn't fall and hurt herself. This was the idea the family had. And then after I evaluated the patient and kind of evaluated the home, I was like, oh, what we actually need is a hospital bed, because it will raise and lower, and we can get this in here before she comes home, and then we can raise it up and she can stand up easier, and then when she's do the opposite when she's getting back into bed. So just people don't understand or think about that. They don't think about bed sores. They don't think about pressure ulcers. They don't think about all the things that you should.
Well, you just made me think about putting things on high shelves. Them being able to get their canned food, their Campbell soup down.
Right.
If the shelves are too high, especially if they're recovering from an injury, you would be able to go in and say, okay, let's bring things down to their level. Let's make sure that they can reach everything.
Or like somebody
something
who just
as simple
had
as that.
Yeah, anybody who just had hip surgery. They're not supposed to bend over more than 90 at the hip, so you need to raise things up. So go through the fridge, and we pull those things up and put them on the top shelves.
What about if they need help with light cleaning in the house during this recovery time? Do you do anything like that?
We do. Yep. We can run the vacuum and swish the toilet and dust and do all those kinds of things too.
What about pets?
Yep. We can help with pet care. A lot of our caregivers really, really love cats and dogs and birds and whatever you have. So lizards, we're not afraid of any of those things. Yes, we can empty the cat box. All that. We can feed them and water them, take them on walks if they're okay with that, if the family's all right with that. Yeah.
Wow. Okay, because that takes a lot of burden off of them, especially if they're recovering, from an injury. That walking their pet, is a big deal. Okay, so the next thing I want to talk about is as respite. So respite's a big deal out there, and I get a lot of calls just in my job of families looking for respite. And if they're on hospice, that is covered, right? Most of the time. Hospice is covered. But where I struggle is a lot of the calls I get, they're families that need respite are Alzheimer's, or dementia, and it's really hard to find a inpatient kind of community that can take care of them. Can you tell me what you do for that?
Yes. So a lot of times we do get calls for family members that are, trying to help somebody through that dying process, and it becomes just absolutely exhausting. It's emotionally exhausting. It's physically exhausting, because a lot of times that person that's in that dying process cannot be left alone at night. Maybe the family's really nervous about them being left alone at night, not knowing if they will pass during the night or if they're going to need anything. Their needs are high. So the family sometimes will just wear themselves completely out, staying up night and day, trying to trade off, and we can come in and take over whatever piece of that puzzle they want. If they want somebody to just come in and run the vacuum and make coffee, if they want us to take over the night shift so that they can all sleep and they can be fully aware and engaged during the day, if they want us to come in and help with the brief changes, because a son doesn't really want to change his mother's brief, a bed bath, anything like that. So yes, we can definitely jump in and help with those things too.
Well, I'm going to share a story, because this is one of the reasons why it was so important for me to bring you on the show. Was we have a mutual friend, we'll call it friend, and it was really important that their spouse make it home to pass, and it was complicated, and it needed to happen immediately, and this other spouse was all by themselves. There wasn't family available in town, and I was told that you had come into the home, you made sure that they had the right equipment, and even though hospice does all this, you stayed the night with the spouse to be with him while his wife passed. So not only were you supporting the lovely wife, you also supported the husband who didn't want to be alone. And I can tell you, to this day, when I run into them, they still tell me how amazing that you are, that you gave him a gift that he was that he will always cherish. And so I want to thank you for that. And I think that's really important, because we can take care of the client and the patient and all that, but family really is part of it too.
Yes.
And in this case,
it's the most important part.
Just being alone would have been really hard, and so you gave support to both sides, and I think that is really amazing and a really good example of what Sugar and Spice can do. So we're going to pause for a moment, because we do need to take a quick break, but when we come back, we're going to learn a little bit about her wellness program and her chronic illness management. And I do want to also talk about what kind of staff that you do have on site, and how do we sign up. So stay tuned. We'll be right back.
Is someone you love dealing with memory loss or the aftermath of a medical incident? Are you a son or daughter needing an extra set of hands to care for your aging loved one? If the time has come for you to decide how and where your loved one would receive dignified and life-enhancing care, I'm here to serve you. My name is Regina. I'm a nurse and geriatric care consultant. I founded Sugar and Spice in-home care to ease the burden of family caregiving and to give your family member the opportunity to live life on their own terms, regardless of any life-limiting condition. Call me anytime, 928-864-5884.
The Bluffs of Flagstaff is Northern Arizona's newest senior living community. We offer a wide range of amenities, including a movie theater, swimming pool, putting green, and personalized concierge services. We offer independent living, assisted living, and memory care. Beat the rush. Visit our Welcome Center and learn about the Bluffs of Flagstaff. Choose an apartment of your choice with a minimal deposit before we open in 2022. Contact Leah Veschio, 928-310-8175, thebluffseniorliving.com. We put the living in senior living.
And now, back to Senior Talk with Leah Veschio, presented by the Bluffs of Flagstaff on KAFF Legends 93.5, AM 930.
Welcome back, everybody. We're here with Regina Deck from Sugar and Spice. Thank you for being on this show. I'm super excited. We're going to talk about, I want to learn about your wellness program.
Sure.
Because I think that's also very unique in our community. Tell me what that is.
We have three main divisions in our company. We have our post-hospital, post-rehab, chronic illness. That's the first one. It's a big mouthful. The second one is our aging in place. And then the third one is our kind of our part-time just little bits, more like the concierge type services. So the first one is our most intensive, and that involves patients who are post-hospital, like they just got out of the hospital, so their needs are higher. They might need round-the-clock care. They might be on a lot more meds than they're used to. They might have a lot more weakness than they're used to having. They might have post-surgical instructions and they're not really sure what they mean, or they're having a hard time remembering them. They might have just come home from the rehab hospital and they've just enjoyed 3 hours of physical therapy every day, and now they're home on their couch and no one to encourage them. So we jump in whatever phase of that they're in. We love to go to the rehab hospital and hang out with physical therapy and occupational therapy and find out exactly what they were doing when they were there, and then continue that same regiment at home, so they don't just come home and take a dive and then end back up in the hospital.
So you help them follow their
months.
home exercises,
Yes.
because you're not physical therapists per se.
Correct.
So if they needed physical therapists, then that's when you would help with home health, correct?
Right. Yes. We work alongside home health.
Perfect.
Yes. But yeah, sometimes people just need that encouragement. I go to the gym, but if I go to the gym and there's not a group of women there with me and a personal trainer who's made up the program, I'm not going to do diddly squat. So it's nice to have someone to come in and be like, okay, Mr. Johnson, we're going to do this one and do it with you. We're going to do our speech therapy exercises with you. We'll sing together. We'll yell together throughout the house and scare the dog. But we'll jump in and do those things with you. We love to dance around the house and turn on music and be fun and active.
Well, it makes it more fun too. When you get those home exercises for physical therapy, you're like, okay, yeah, I'll do that, on the commercial. And then let's face it, we don't, right?
Right.
And then when you go to physical therapy, they totally know you weren't doing your home exercises.
Yes.
So this way you kind of make it a fun environment.
Right. And the family caregivers are already overwhelmed enough. They're managing the home, they're managing all their other side of this and the medical aspects and the doctor's appointments and cooking and the bills and everything it takes to run a home. And then you have your spouse or your mom or dad come home and they have this whole program that they're supposed to be participating in so they don't get worse. And it just feels overwhelming for those family caregivers. So it's really nice to have another caregiver come in and help with those things.
What about diets? I read in the wellness that you help, because I know nutrition's always plays a factor, especially as we get older. Our taste buds are changing. And so what can you do to help our seniors with diets?
So small portions are a big part of it. Also sweet and salty. There's also a whole aspect to eating and dieting, like, for example, sleeping. A lot of folks that come home from the hospital or in general have a hard time sleeping. Maybe they're up and down throughout the night. Well, magnesium is a huge part of that. So at night, it's important that we encourage magnesium intake, either through peanut butter, a glass of milk, and having nutritious snacks that cater to the aspects of sleep and those circadian rhythms and all those kinds of things that help people.
See, that's where the clinical piece comes in again.
Yes.
So that's where your clinical expertise, because I'm like, oh yeah, I forgot about the peanut butter. So do you work with physicians then directly? Like if you recognize in a patient,
Yes.
resident or client, if you need magnesium ordered or, some sort of medication, do you work directly with the physicians?
We do. We work with physicians a lot too with detecting things early, like infections. So our staff are trained to watch for signs of infections. And if we see any of those things, then we communicate with the doctor and say, hey, we're seeing this. Can I come to your office? Do you have a urine cup? Can I come get it and bring it home and bring it right back to you? And we can get this UTI figured out right away. We do
saving a
like
trip
that.
to the hospital.
Yes.
Yeah.
Yeah. And saving a bad infection to the point where they would have to be admitted to the hospital. We can catch those things early.
So back to diet. Do you cook?
Yes, the caregivers cook and clean
whatever
and
they want. Like
everything.
If the family says, they love hamburgers, can you grill them? They'll go grill them.
Yeah,
or
we
whatever.
can do that.
I don't cook, so it's going to be really hard here.
Yes, yeah, we can grill and cook and bake, and that comes back to the whole sugar and spice idea of doing those things.
Do you encourage the loved ones to help cook, like the client, like especially I think about with Alzheimer's and dementia? Doing those, keeping those fine motor skills up. Do you encourage them? You don't bake the cookies.
Yes, absolutely. Yeah, getting in the kitchen and doing that with them. Right, and whatever stage they're at, we really like to find that out and then build on that. So you might have somebody who had a funny story, but was making cookies with a client, and she loved to bake, and I thought that she would totally dig this, and we're making chocolate chip cookies, and it's at the point where it's just the butter and the sugar, and I give it to her to stir it up, and she just reached her hand in there and grabbed a big old blob of it and stuck it in her mouth, and she's like, oh, not quite ready for that step. Okay, back up. I'll do this. I'll let you eat the dough in a minute. But yes, we do like to have them help, and that's the thing, is we're here to help them maintain their independence, not come in and take over.
Right.
So it's very important that people still brush their own teeth and brush their own hair, and, for these gentlemen to shave themselves with the electric razor in a safe manner. And those life skills are really important that they maintain. So it's important that our caregivers are patient and we take our time with them and let them work through a process of whatever that is.
So that's a great segue into your caregivers. What kind of training do they have?
So yes, we have a whole certified wellness geriatric aid program now that we can certify all of our aides in. And so yes, we train on the different chronic diseases. We also train on just how to do a bed bath, how to do transfers, what's a gait belt, how do you actually work that gait belt. It needs to be really, really tight. Most people don't make them tight. Brushing someone's teeth, helping them with oral care, helping them with a bath or a shower. And we really love to make it more of like a salon style for a bath. Let's get the bathroom nice and warm, because everyone knows that as you get older, it seems like mom and dad hate to take a shower or they hate to take a bath. So how can we do this? Let's find those great aromatics and bring them into the bathroom and get those candles lit and get the shower nice and hot, and let's do the lavender and the essential oils, and let's make it a salon day and take our time and get some soft music playing in there and just make a morning of it.
Wow. All right. So real quick, I do want to touch on, then we're going to get into how we sign up.
Okay.
The Chronic Illness Management Disease Division you were telling me about. Can you share a little bit about what that is?
Right. So let's just think about like congestive heart failure. So if you have a patient who has congestive heart or COPD, they're in and out of the hospital a lot and they have these issues. So one of the things that we would instruct and train in our division for that would be that a congestive heart failure patient needs to be weighed every single day. We got to make sure that if there's even a couple of pounds in weight difference, that could mean that water is building up, their heart's having a hard time, fluids are building up in there, and one of the first places it's going to end up is in the lungs. And then they could, become hypoxic, and then they're prone to pneumonia. And so that's just one of the parts of the care plan would be, okay, get Mr. Johnson on the scale every single morning at the exact same time. Not the exact same, okay, within reason. Put him on the scale at the same time and get that weight. And then we're watching for signs of hypoxia, and we're watching for confusion, and we're watching for the cough. We're checking the pulse ox every day. And we can do some, little things like that. Blood pressure.
So this kind of service can get you to go home versus maybe going into a skilled nursing facility. In some situations,
Sure.
It might give them a better chance of being able to go straight home by
Yes.
having those extra things that really an inpatient facility would do.
Right. Because in a post-hospital situation, normally Medicare pays for those rehab 30 days or 2
Right.
weeks or whatever. And so they're getting physical therapy, speech therapy, occupational therapy, and then they have hands-on 24-hour care by the facility to help with bathing and transfers and helping them to the bathroom and all that. Well, we can do a lot of that at home. With home health coming into the home and working with them there, then we can provide the other segment of that with the helping with the transfers and making sure they're safe and they can get up and down, and those brief changes or, cognitive issues that relate
We
to
keep
safety.
them for readmission to the hospital because you're
Yes.
continuing what the skilled nursings have done, but
Right.
at home.
Right.
So this sounds really fabulous, actually. But my question would also be about turnaround time. So usually when people need these services, so they needed them yesterday. What is your turnaround time in getting someone signed up, and do they have to sign a contract or all those little nitty-gritty stuff?
Sure, that's a great question. We will do our initial intake within 24 hours of the call. So we usually do it on the same day, but if not, it's at least within 24 hours. And then depending on what their needs are, we get services started right away.
You don't have to go into details on costs, but it sounds super expensive. Do you do you pay on sliding scales? Because you don't take insurance, I'm assuming. I'm assuming this is private pay.
It's all private pay. Long-term care insurances do reimburse for our services.
Okay.
Yes, they do. And we help with processing that paperwork as well.
Great. What about any, like, I don't know if this is a thing, but for VA or for vets?
We are not signed up with VA or Medicaid.
Okay.
Usually those services only pay for short amount of time, 2-3 hours at a time. In my opinion, most of those patients that get approved for those programs need a lot more than that. And so it's just not the kind of service that I would like to provide.
Okay. What about minimal care? Do you have to sign up for like 4 hours, or is there some sort of a minimal requirement?
There's no minimum. Nope, no minimum and no contracts. So our prices range from $22 an hour up to, you can choose a flat rate where you just want somebody to come for, we have a 1 minute to whatever.
Okay.
So they can choose anything in between there that they want. If they just, some people think this is way too expensive, there's no way I can afford this, but you can choose an hour, 2 hours, and that makes it really affordable for people.
So if I wanted to hire you to go see my loved one, just to go look at their house to make sure when they get discharged it's safe, I can just pay for that.
Sure.
And I don't have to. You don't have to worry about doing care. I just want to make sure that they have everything they need in their home. What if I wanted them to stock their refrigerator because they've been in the hospital for 2 weeks,
right?
That kind of stuff. Like we could do that. I mean, I know it sounds simple, but that's like your concierge program, right?
Exactly.
And then to the more advanced is, can you please stay with my mom for the next 48 hours when she's home from the hospital? Because I think the struggle with what I've learned is there's so many family members that are out of town, and it's really hard for them to get here. And they're also, like you say, they're juggling their own lives. And so you could really, I can see where you can take up a lot of slack, but it may not be a long-term experience.
Right. And some families even choose to sign up with us before they need care, to have that comfort level of, if anything happens, I already have this company in my back pocket. They've already signed up. The paperwork's done. They've met my mom. They've toured her home. They know how she likes everything. And in the event that we were ever to need her, we can call them. And you don't have to wait until that crisis happens.
Right. And then you could do a welfare check in a sense, right? Because you're already signed up.
Yeah.
Mom hasn't answered her phone for, today, and I'm really worried. Would you go do a welfare check?
Yeah. We have some clients that have just signed up for, please go check on my mom and hang out for an hour once a week.
Wow.
Okay. Yeah.
Okay. And so how do you sign up?
So you call us at 928-864-5884, and that's all you do. You just give us a call, and a nurse will call you back. We'll ask you a few questions. We'll set up a time to come out and do a home evaluation and the intake appointment. And like I said, it happens within 24 hours usually, and then we just go from there. We cater the care plan exactly to whatever the needs are for that family member.
Okay, so I do have a real quick question before we end. So being a nurse, that you are, and working in more of a clinical-based setting, what made you do this? What made you switch over?
I just always loved hanging out with the elderly population. Whether I was in ICU or the ER, I was just always drawn to them. I was one of those candy stripers. Remember that term?
I was a candy striper.
Yeah,
we're dating ourselves.
Junior high candy striper. My grandmother was one of my most favorite people on the planet, and I was very close with her. And so it's my natural kind of a niche to do this, and it's such a much needed category of care
resource
in our community, because no one does this. Usually caregiving companies don't have the medical component, and so we have both, and if needed, we could go to the home, draw blood in the middle of a snowstorm and get that done so they don't even have to leave the home. So there's different nurse type things that we can do. Overall, it's the more of the companion non-medical services that are our bread and butter.
Well, I do want to thank you for providing this resource in Flagstaff, because I agree with you. It's definitely a much-needed resource. It really helps, take a lot of pressure off of our existing healthcare system, is what I can see in that. And this time, we really need, any relief we can do. So thank you for that. And thank you so much for joining me today for Senior Talk.
You're welcome.
If you guys have any questions, you know how to get a hold of Sugar and Spice, and we will see you in a couple weeks. Thank you. The Bluffs of Flagstaff is Northern Arizona's newest senior living community. We offer a wide range of amenities, including a movie theater, swimming pool, putting green, and personalized concierge services. We offer independent living, assisted living, and memory care. Beat the rush. Visit our Welcome Center and learn about the Bluffs of Flagstaff. Choose an apartment of your choice with a minimal deposit before we open in 2022. Contact Leah Veschio, 928-310-8175, thebluffseniorliving.com. We put the living in senior living.
Is someone you love dealing with memory loss or the aftermath of a medical incident? Are you a son or daughter needing an extra set of hands to care for your aging loved one? If the time has come for you to decide how and where your loved one would receive dignified and life-enhancing care, I'm here to serve you. My name is Regina. I'm a nurse and geriatric care consultant. I founded Sugar and Spice in-home care to ease the burden of family caregiving and to give your family member the opportunity to live life on their own terms, regardless of any life-limiting condition. Call me anytime, 928-864-5884.